drugs that a plan covers. If you're taking an infusion treatment or get regular MRIs, what does that coverage look like, and how will that financially impact you?
Well, I just heard you mention the formulary, and that's perfect because we've received a question from Sebastian. He tells us that he's living with MS and he's on a disease-modifying therapy, along with treatment for hypertension and diabetes. And Sebastian is asking if he needs to check the list of covered drugs before he selects a plan. And he wants to know what his options are if one or more of the drugs that he uses isn't covered. So what can you tell Sebastian and others who may be feeling nervous about being in the same situation?
Absolutely. Yeah, so definitely you want to make sure that your medications, or as many of your medications as possible, are on that formulary, that list of drugs that the plan covers. And there are also a variety of options if you have a medication that's not covered. One of the main ones that we have resources for and is a common option is to use the plan's appeal process. And we even have sample appeal letters on our website for those.
Well, when choosing a health plan, how important is it to consider which providers, which doctors are what they refer to as being in network?
Mm-hmm. So if you like your current provider or providers, then what you want to do, and those providers can include your primary care doctors, if you have PT, therapists, anyone that you get services through, you want to do the research to find out if they're in that plan's network. And that network is the list of doctors or medical professionals that they will help you pay for the most. So if you want to make sure that your providers are in network, we suggest you can call the plan. You can go to the plan's website. They'll have a list of their providers on there. And so you can check and see if they're there. We also suggest checking from the other end too, calling your providers and asking them, hey, are you going to continue to take this plan next year? Or I'm thinking of switching health insurance. Do you take this plan in 2022? So you kind of want to check both ends of the spectrum to make sure if you really want to ensure that you're keeping your providers.
Now let's get into some of the specifics about open enrollment. It's a relatively short period of time, but it's an important period of time. The decisions people make can have a pretty significant impact throughout the following year.
Mm-hmm.
First, can you tell us what open enrollment is and why it's so important?
Yep. So open enrollment is the time of year that your 1-year contract with your health plan expires, and you have an opportunity to continue with that named plan for the next year or switch to another plan.
And what are the open enrollment dates for 2022?
So for 2022, group and employer coverage, that biggest bucket of health insurance that people have, it's going to vary depending on the employer. Some have fiscal years, some have annual, so you want to pay attention to the information you're getting from the employer that's providing that group coverage. Marketplace open enrollment, so the individual plans, for 2022, that open enrollment starts on November 1st. So that's when the 2022 plan information is going to come out. It ends on January 15th. But if you want your individual plan to start on January 1st, you have to enroll by December 15th. Also, the states that run their own marketplace and don't use the federal program, they may have some extended dates out there too. So it's important to kind of pay attention. And then Medicare's open enrollment starts October 15th and ends at midnight on December 7th.
I think open enrollment is all about making important decisions, and making decisions usually comes down to sometimes thinking about risks and rewards. What are some risks people may face during open enrollment?
Right. So you want to make sure that you aren't just saying, well, that worked for me last year. I didn't have any major issues. It's going to be the same next year. Like we said before, plans can change their formularies, what drugs they do and don't cover. Plans can change the cost structure of those drugs. Plans also and doctors can change in and out of the network. And then the cost structure around deductibles, premiums, all of those things can shift or change from year to year. So it's possible that the plan that you had last year that worked really well for you is going to be similar enough that you're not going to notice any differences. But it's really, really going to be the best thing to make a safe bet to just double check that. Because if something even small changes, it may have a really big impact on your finances for the next year.
So what are some rewards for making informed decisions during open enrollment?
Um, so you rewards are that you're going to be able to continue to access those medical professionals and that team that you're already working with and have a relationship with without any hiccups the next year. You may be able to find coverage that saves you some money, and you may be able to find a policy that just works better for your lifestyle and your needs.
Alexander wrote us asking if there are any changes in open enrollment dates or the process itself due to the COVID-19 pandemic.
Maybe. There were some changes. We saw a lot of extensions in the marketplace, open enrollment last year because of COVID. Things seem to be kind of in place for next year. Open enrollment is longer than it was a couple years ago already. Um, and but some states may still enact some changes to their marketplace. Medicare isn't really impacted by COVID changes for open enrollment this year, and then employer coverage. They get to make their own choices each year how that works anyway. So we haven't been able to track if there's been any impacts because of COVID.
So are there any special enrollment periods that we should be aware of?
Um, Sometimes you can get what's called a special enrollment period triggered by life events like moving. Also, Medicare has a lot of funky kind of rules that allow changes to Medicare Advantage plan choices. Um, but there's a lot of ifs and buts involved in those. So we would love for you guys to reach out to the navigators and we can kind of wade through that with you to check and see if there's any open enrollment or special enrollment that you can take advantage of.
We're going to circle back to those Medicare Advantage plans in just a few minutes.
Yeah.
Meanwhile, we've heard from Carla. She says she's moving and she's wondering if there are states that run their own marketplace and don't use the federal government marketplace.
Yes. There are about a half a dozen, about a dozen states that run their own marketplace. And if you use healthcare.gov, their website, and go to find local help, that section, or just put in your state's information, it's going to point you right to the right place for you to shop for health insurance based on the state that you live in.
Joseph wrote, and he's asking if there are changes to his health insurance plan, when do those changes take effect?
Right. If you hit all the enrollment dates on time, your plan changes will take effect on January 1st of 2022. So for example, if you enroll in your marketplace plan by December 15th, then and Medicare by December 7th, then January 1st is going to be your plan change date.
We heard from Jawan who wants to know what happens if he changes his mind after the open enrollment period. Can he go back and make changes to the plan that he selected?
That depends. So I think that's another situation where give us a call and we'll kind of try and help you through that maze to see if there's an option to change.
And we also heard from Joanne, who asked if she needs to take any action during open enrollment if she's not making any changes to her current health plan.
Yeah, we talked about that earlier, and it is really tempting to just put that aside and not have to go through that maze again of trying to figure out what health insurance is going to do or not do. So it's really easy to say, yeah, this worked for me last year. I'm just going to stick with it. But we really, really encourage people and want to help people to go ahead and double check to make sure your meds are on the formulary for that year. Your doctors and healthcare providers are still in network, and there's not going to be any huge changes to the fee structure.
Let's talk specifically about Medicare open enrollment. Now, I think you mentioned that the open enrollment period for Medicare begins October 15th. Who can take advantage of Medicare's open enrollment? Is it just for people who are already on Medicare?
Yeah, so people who have Medicare, or have started Medicare as recently as December of 2021 are going to use the open enrollment period to look at their new 2022 options. Someone that is new to Medicare, so maybe didn't have Medicare coverage at all in 2021 or previously, they actually get a bigger window of opportunity to assess and look at plan options. So it's kind of nice that you have that larger window, but open enrollment is specifically for those individuals that already are on Medicare.
While we're talking about Medicare, can you help us understand the Medicare benefit structure?
Oh boy, I hope I can. Um, this is a big question, and sometimes we can take as long as 20, 30 minutes to talk to people about this to make sure that they understand the foundation of what Medicare is. But real quick, and don't feel bad if this isn't super clear when we get done. We're more than happy to, again, have a deeper conversation with you if you want some more help understanding Medicare by calling one of our navigators. But there's lots of parts and there's lots of options, which can be great, but it also can be overwhelming. So Medicare Part A is one of the main parts of Medicare. You hear people call it hospital coverage, but I actually call it inpatient coverage because it's for when you're inpatient in a hospital or a skilled nursing facility or a rehab facility. Medicare Part D for drugs is how I call it, D for drugs, and that's for prescription coverage. That's any medication that you give to yourself. So that you actually handle is what is covered under Medicare Part D. And then Medicare Part B, that part that I kind of just skipped over, that is the biggest part of Medicare. It covers everything else. So if you are seeing a rehab specialist, if you're seeing a therapist, if you're going to a primary care doctor, if you need to go to the ER, if you have an outpatient surgery, anything that's not a prescription drug that you give to yourself or an inpatient stay at a facility, it's covered under Medicare Part B. So it's by far the biggest piece of Medicare. And so you can have original Medicare, which is the A and the B, and you choose your D, or you can kind of take an alternative route. And those are called Medicare Advantage plans. Medicare Advantage plans are actually plans through private insurance companies, and they're an alternative to Medicare, but they do provide similar benefits. They just tack on some additional things to entice you to go ahead and join their plan over having original Medicare.
I know that the National MS Society's MS Navigators can help people affected by MS to navigate the open enrollment period and make the very best choices for themselves. You've mentioned a few times how beneficial that can be. How can people reach an MS Navigator?
Yes, so call us 1-800-FIGHT-MS or 1-800-344-4867. You can go on our website and start a chat with a navigator, or you can email us. Our email address is contactus@nmss.org.
And what can people expect when they call an MS Navigator?
So when you're calling us and during open enrollment, we're going to be able to dig into Medicare plan options with you. So we're going to spend some time explaining terms, options and things to consider. If you're on Medicare, we can use Medicare.gov's website to do a plan search with you or for you to help you narrow down those options so that you can make an informed decision about what you want for your 2022 coverage.
Trisha wrote in with a question. She'd like to know whether MS Navigators can help people navigate those health insurance marketplace websites.
Unfortunately, we can't. There's a variety of reasons that we don't have any access to backdoor information on the marketplaces, federal or state sites. We find that the best option for individuals that need help with the marketplace options is to go to healthcare.gov and use the Find Local Help tool that they have there. And what you're going to do is you're going to put in your zip code or your city and state, and they're going to give you a list of assisters in the area that you can reach out to that can walk you through those plan options and give you some information about any tax credits or cost sharing you may be eligible for based on income. And then our website also has a section called Get Covered. And there's some documents on there that give you some check marks and some things to pay attention to when you're shopping for a marketplace health insurance so that you don't miss out on some piece of coverage or something that you need to track so that you don't miss what would be a good option for you.
Well, beyond not being able to get into those marketplace websites, are there any other things that MS Navigators can't help with?
We can't dig into private insurance policies or those group insurance policies because again, they just vary depending on what the employer has offered as a benefit for enrollment. But we can really dig into Medicare because Medicare is consistent across the board. We know the rules and regulations. It's going to apply the same for every state, no matter where you live and who you are. And we also get the question a lot too. People want to know which health insurance company is good for people with MS. And there's really not an answer to that question. We're going to focus on what is good for you, as your MS is different than anyone else's MS is. So we can't tell you which plan to pick, but we're going to do our best to help you simplify and drill down those choices.
I think you've already started to answer my next question when you talked about some of the documents available on the Society's website. Are there any other tools or resources that people can use to help them make those very important decisions?
Yeah, absolutely. Talking to one of our navigators is probably going to be the easiest thing. When you talk to us, we can help you understand terms, point you in the right direction of what to look for plan options. But on our website, we also have a whole self-service section. If you go to mssociety.org and /get covered, there's a lot of tools there, documents that you can download and bring with you to any appointments that you may have, or have handy while you're going through your employer offers or marketplace offers too.
Well, Nicole, you've shared some great information with us today, things that'll, I think, really make navigating open enrollment a lot easier for people. What would you say are the top 3 takeaways that you'd like us to remember?
Okay. Top 3 takeaways I think the navigators would suggest are going to be pay attention to those dates. Don't miss your chance to take some more control of the coverage options that you have. Don't assume that what you had last year can't get better or won't change. Ask questions and check the benefits just to make sure that it's still going to be a good option for you. And then lastly, it's okay to feel intimidated and frustrated by health insurance. It just is a big question mark for a lot of people, and no one has a crystal ball to be able to predict what your health needs are going to be for 2022 or in the future. But we're here to do everything that we can to provide you a foundation of information to help you make an informed choice for your coverage.
Well, thanks for sharing your expertise with us today, Nicole.
Yeah.
We have time to field a couple of more questions from our
Sure.
viewers. We heard from Maria, who says her mom doesn't have a computer, and she wonders if there are other ways for her mom to enroll in Medicare.
Yeah, so Medicare, you can call 1-800-Medicare. And they will also do the plan search with you. You can call us and we can go on Medicare.gov's website with your information and narrow down plan options from there. And then we can put a packet of information together and even mail it or send it off to a family member for them to help you look at on the computer. But absolutely, we can still help people that don't have access to a computer here through the Navigator program. 1-800-Medicare has help with that. And then, you know, some people will use health insurance agents or brokers too, and they can help get you enrolled.
Evelyn asked, can I get Medicaid if I have MS?
Possibly. Medicaid for some states has a two-tiered requirement that you have a disability, a condition that deems you or that deems you disabled by the Social Security Administration, and also that your income is at or below that state's percentage of the poverty level. So that's for some states. For states that expanded Medicaid with the Affordable Care Act, you may not have to meet the disability requirement to be eligible for Medicaid, but you still have to be at or below the income threshold to be able to be eligible for Medicaid.
Well, I want to thank everyone for submitting your questions, and thank you, Nicole, for being with us today.
Absolutely.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are the resources that you can count on to be current and credible. First, I'll remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on MS, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends, ways to get involved, and upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Nicole Vasquez for joining us today. Please remember that a recording of this webinar will be available to Society's website at nationalmssociety.org/msexpert, as well as on Facebook and YouTube. And I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's program is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. On YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute and please fill it out. On behalf of Nicole Vasquez and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.